Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. If you're new to the podcast, welcome twice. Today, you are going to have such a delightful person here. We have Susan Spargo. Susan, welcome.
Thank you.
Thank you for accepting to be here today. So for the audience, Susan, you were 55 years young when you came to see me for the first time.
Yes.
And 55 is a very young person, you know? So we're talking about we're starting to leave, no? So why do you, so the audience know what is Susan's story? How does she end up in the cardiology office? What is the deal? What do we have to think about her story? Why don't you start telling them how did you end up in my office and what was going on?
I was having chest pain probably for 6 months or more. And I had just moved here recently, so I didn't have even a general practitioner at the time, really. So I had a neighbor that suggested I go see. They said that their husband was going to your practice, your old practice with the other doctor you used to work with. So I went into your office to make an appointment, and they asked me why I was in there to make my appointment. And I told them, I said, well, I'm having chest pain. And she got me in the next day. So that's how
You give the right answer, the right code, ding, 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 go inside.
Yeah,
okay.
yeah, so
you established because you were already having a problem.
Yes.
Yeah, so, and then you recognize, in a way, I would say, it's a blessing that it was chest pain, because then chest pain, people think about heart. Yes.
Yeah.
And although in your case, it was definitely your heart, not every woman will necessarily present with chest pain when they're having heart problems. And that's the idea of having this podcast, you know. So when you go through the stories that the women are sharing with us, some are short of breath, some have pain in the upper back, some have discomfort in the jaw, and some have chest pain. So the absence of chest pain doesn't mean it's not the heart, but the chest pain makes it a little more obvious. So for you, it's like, this is definitely my heart because I'm having chest pain. Yes.
Right.
So when you came to see me, you were having chest pain. We run some tests. Your story was very strong for me that you were having a cardiac problem. It was clear to me the way the chest pain was happening. Worse when I do physical activity, gets better if I relax and I don't do much. So it was a typical classic angina symptom. Yeah. But with the tests that we ran on you didn't show anything. No, so they were all normal. You come back to the office, and then I decided that, okay, so we need to get to the bottom of this. And then I suggested to do a coronary angiogram, which is that test where we go inside the heart to look at the arteries and try to understand. And the reason why we offered that to you was, number one, we have a normal stress test, but that doesn't mean that that everything is right, that nothing is wrong. The patient is in front of me, you are in front of me telling me, I'm still having the chest pain.
Right.
We started treatment on you for your angina, and then the coronary angiogram is going to help us understand the mechanism. What is causing the chest pain? Is it plaque obstructing the flow, or is a different mechanism like is more common for women? Is it dysfunction of the arteries? Are they not relaxing properly? Are they spasming? But unfortunately, your insurance denied the procedure because they didn't see the indication for it.
Right.
When we talk about not knowing that heart disease in women is different, in prior podcasts, I have discussed that the stress test that we ran on our women today is men, or I would say the majority of the tests, It's meant to detect disease in men. You know, everything that we know about heart disease until today and the recent data that we're obtaining is it was collected in men. So the most common cause of heart disease in men is blockages. So the tests were designed to look for blockages. But guess what? In your case, it wasn't because of blockages. It was a different mechanism. So no wonder the test wasn't showing it. Yeah. But not only do you didn't know, other providers don't know, the insurance company doesn't see the importance of getting that test done. So we continue to optimize your medical therapy, work with your medications until you kind of like feel like you can function. Yes? Tell the audience what the medications did for you.
So I wasn't getting the chest pain. And also I was able to like walk, or I don't do a lot of exercising per se. I do a lot of walking though. And I did a lot of walking without a lot of either chest pain or like having to slow down because you were getting tired and out of breath.
Okay.
So
normally when patients say, how do I know that this is working? I'm like, you will know. Because your symptoms are going to start getting better, no?
Yeah.
So, and then some of the subtle symptoms, like the one that you just mentioned. We started with chest pain, but then you said, I was getting tired. Like I realized that I was getting fatigued, and then I was able to do more without without hitting that point. Fast forward a few years later, you needed a procedure, and you needed clearance for surgery. And we did a stress test again. That was almost 3-4 years later. That stress test shows an abnormality. It was abnormal. Then we were able to get a test. We call it a CT angiogram. Okay. Yeah. So a CT angiogram is a CAT scan that is similar for the audience. When we talk about CT angiogram, the CT angiogram is a CT scan. You're going to get an IV. They're going to inject a dye. Yeah. Similar to how we look at the arteries when we do a coronary angiogram without the invasive part of it, but it's only diagnostic. So if we have a young patient that have an abnormal test and we are suspicious that they have a blockage, a CT angiogram will be an alternative. Or if a young patient is showing up in the emergency room with chest pain, a CT angiogram will be a good alternative. Now, because it's just diagnostic, that means if we see a blockage, we're still going to need to do a coronary angiogram. However, if we don't see blockages, then we can say, okay, so nothing to be concerned. Let's focus on treatment. The CT angiogram showed that you have plaque, not significant enough to put a stent, right. But then also, again, emphasize that your disease was the typical mechanism of a woman, whereas like my arteries are not blocked. Is that they're not relaxing? Is that they're not relaxing well? They're too stiff or they're spasming, no? So once we had that data, then now we can have a stronger, more data to support that. What else do we need to do to help you stay healthy? Now, cholesterol management, blood pressure management, besides the therapy that we're giving you for your heart. So when I talk about your case, I want the audience to understand that, number one, a normal stress test doesn't mean that everything is okay. If you're having symptoms, you got to keep saying it until somebody understands that what you're experiencing is real. Because just like you, Susan, if you did not end up with a provider that understands that, probably once the stress test was normal, you have been told this is not your heart. Yes?
Right. Yes.
So what would you say to the women that are listening to us in terms of your experience at the practice and your experience in the journey as you were going through this process? Was it scary? Did you feel comfortable in the place that you were? Would you have done something different?
I was made very comfortable by all the staff that are there at the office. And at first I went in not knowing, what was wrong. My brother previously at 50, like 3 years before I came to see you, had just had a quadruple bypass.
Were you scared when you came to the office?
Kind of, yeah. Because I know my mother had a heart attack too previously before she passed. So
Was I the first cardiologist that you ever saw?
yes.
So even though you knew that your mother had the problem, your brother, do you know that you were high risk?
Kind of in the back of my head, I knew.
Was it mostly related to the family history?
Yes.
Okay,
Yeah,
so
never
see-
from a doctor or
Okay.
anything like that.
And you never knew that your age alone put you at risk for heart disease?
No.
You thought that you were too young?
No, because my brother had his heart attack so young, that kind of, I think if anything in my head made me say like, oh, you better go do something about this and not ignore it.
Got it. So you did not necessarily put the menopause as a risk for heart disease.
No, I
because did you know that menopause
No.
put you at high risk? Okay. So this is the first time basically. So for you it was more about family history, for which is so valuable, the family history. You know, when we look at risk factor for heart disease, family history play a role. So if you have a provider or anybody, for the audience, if you have a provider that tells you family history is not important, family history is important. I will share this with you. My mom went to see a primary care doctor who shared with her, it doesn't matter what your family history is, because my mom's mom had a heart attack when she was in her 40s. Okay. So my mom is telling him, my cholesterol is a little high. I don't want to change. I want to take medications. I don't want to take a risk. My mother had a heart attack when she was young. Right. And then he said, your family history is not important. So family history is super important when we come to risk factor for heart disease. But not only for that, is to empower you and give you a knowledge. Like in your case, I said, well, listen, somebody already went through a major issue, heart attack, open heart surgery. Take that to your advantage. In your case, you waited until you were having symptoms, even though you knew that you were high risk. Yeah.
Right.
But at least it gave you the power, because you're like, oh my God, this is my heart. And with my history, this is definitely my heart. No? Yeah. So then that way, knowing the history help you to say, I know what I'm going to do. I'm going to go and see a cardiologist, rather than going in a system and trying to figure it out what is going on with you. So take that knowledge and use it in your advantage. And for the women that are listening to us with this story that we're sharing today, I'm going to say, number one, if you don't know your family history, start asking. Yeah? So when we talk about family history, it's immediate family. You know? So did dad have a heart attack or was diagnosed with heart disease prior to the age of 55? Did mom had a heart attack or was diagnosed with heart disease prior to the age of 65? And that will apply to brothers or sisters. If it's a man, the same as I just said, that younger than 55, or if it's a sister, younger than 65. So that is what count for family risk. Now, yes, if your aunt or your great-great-grandparent, granddad had a problem, well, you probably wanted to just take it a little more seriously with your other risk factor. But when we're asking you about family history, it's like, is mom and dad, do they have history of heart disease or stroke? How old were they when they were diagnosed? That means that it's premature. That means that you're at much higher risk of having it at younger age. So therefore, don't wait to have chest pain, which in your case, I am so blessed that I was able to help you, and I'm blessed that you decided to come and see me. But like not many women are like you. We have a lot of women that we're burying every single year. We're still burying about 350,000 women because they don't know that they have a heart problem, because they're experiencing symptoms and they don't know, because they're ignoring it, because they're being ignored, and because they're not using us. We are here to help, but you had to come. You had to come so we can actually get a good idea where are we and what are we doing. Don't you agree?
Yes. Yeah, I do agree. I just bring another point out though. I mean, I'm lucky to have found a doctor like you, but I mean, some other doctors don't make you feel like you're comfortable telling them, you know, what you may be experiencing, because they make you feel like it's not a problem for you. So why would you tell them something if you don't feel like they're going to listen to what you're saying?
And you know what? That is actually, I'm so glad that you brought that up, because sometimes we said, well, women don't speak up. And then you're saying, well, sometimes we want to speak up. Sometimes we choose not to speak up because we already try and we see that the receptor wasn't there for us. And then you're like, why will I say something if I know that I'm going to do anything about it? At the same time, for the audience, if you are in this prerogative, when you feel like I have a doctor that I rather don't say anything because first, they always dismiss everything that I said. Like, that is not important. They don't pay attention to what I have to say. So I'm not going to share. But then that can cost your life. Yeah. So then it's like, you got to move out of there. Like, if you're in a situation where you feel that you're holding back on data that is important to fill the gaps, because your doctor has not made you comfortable with that, because it always dismisses you or it doesn't think that this is important, doesn't make you feel important, then you got to get out of there, because it's going to cost you your life. It's going to cost you your life. So having had the experience, I think that we cannot advocate more about be the CEO of your own health, mean take charge, speak up, change your doctor. You had to change your doctor. You got to feel comfortable with your doctor. You had to sit down with somebody that said, I get you.
Yeah.
And I'm honored to serve you.
It's really important for anybody to know that they can go out and find somebody, though, that will listen to them.
Mm-hmm. And for them to know that they're there, no?
Right.
I know that we also want to give the audience the hope that there's people out there, no? So I know that sometimes we joke here about patients saying, you need to come and see Dr. Alvarez. And I say, well, there are other Dr. Alvarez out there. So the goal is that you find that partner where you feel that you can trust them, that they're listening to you. And the same way that you found me, the same way that other of my patients have found me, there are doctors in other places. And we have discussed them in this forum in the past. You just have to persevere and make sure that you are advocating for yourself.
Yes.
Yes. Do you want to share anything else with the audience?
Just that I think that you'll feel better and you'll have better quality of life if you are able to find the right doctor. And it's not easy, because in the past I've gone through like a couple of different doctors before you find the right one. But it's worth doing it if you take the time to do it.
And then, do you agree with me that once, like, for example, when you came and we found out what your problem was, and then we started treating you, and then you felt better, it's such a relief to know that I know what I have.
Yes.
This is my condition. This is how I get treated, and not being so afraid of every time you get one of those chest pain thinking I'm going to die.
Right.
Yeah. So be able to kind of like, I know what I have and I'm in control.
Right.
Yes.
Yes.
I think that also, if for nothing, the women that are listening to us should get checked just to get an answer to why are they feeling the way they're feeling, and then just get that peace of mind. I think it's just doesn't have to be anything bad, and if it is, then know and correct it. Agree?
Yes, I agree.
Okay. Thank you for being here today, Susan.
No, you're very welcome.
I appreciate you. Thank you.
It was good to see you.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.